So let's talk about the new topic, that is joint disorder. So in joint disorder, first disease is osteoarthritis. So you have to understand, I have explained you osteoarthritis degenerative disease. Degenerative disease is we are walking on knees since we born, so it causes the degeneration. So you can see this is the normal joint space, this is the loss of joint space. Okay, this is arthritis. It has 4 stages, stage 1 2 3 4. Okay, cartilage. So, and you have to understand, PIP joint, MCP joint is spared in osteoarthritis. PIP and DIP joint involved, but first CMC is also affected in osteoarthritis. It is the most common joint disease. It is degenerative disease of cartilage. Cartilage destroys bones and rub each other. It causes the pain to the patient. I've explained you about the osteoarthritis. Osteoarthritis is a degenerative disease because we are walking on knees, so it is most likely to develop in knees first, then on hip because it is also weight bearing joint, then in ankle joint it could be their wrist joint, PIP and DIP joint, but not in MCP joint. MCP joint is spared in osteoarthritis and DIP joint is spared in rheumatoid arthritis. So rheumatoid arthritis is an inflammatory disease. Okay, so it causes the pain. It is sclerosis, regeneration of osteocyte, and medial joint space is reduced first because the anatomy of knee is such like that we are having much more weight on the medial side than lateral side. Okay, it has decreased joint space. It is the earliest X-ray finding. Now the X-ray finding is joint space narrowing, osteophytes, subchondral sclerosis, subchondral cyst. Osteophytes are these. There is so many osteophytes in osteoarthritis patient. Subchondral, so these are the X-ray findings. Subchondral sclerosis, you can see here sclerosis here and here. Subchondral cyst formation. Okay. Now Boychner nodes. So Boychner nodes is seen at PIP joint. Haverden nodes is seen in DIP joint. Okay. So swelling at PIP is Boychner nodes. Swelling at DIP is Haverden nodes. Okay. So these are the osteoarthritis changes. Treatment is by physiotherapy in initial stage. In stage 1 and 2, we will manage by giving NSAID and physiotherapy. And late stage, 3rd and 4th stage, we will go for total knee replacement. I have explained you about the total knee replacement. Okay. In young patient, we will go for high tibial osteotomy. Young patient. Okay. Now, rheumatoid arthritis, I have explained you, it is inflammatory arthritis, erosive type. Female has more common than male. It is autoimmune disease. RA factor is the investigation which causes the leading to inflammation and destruction in synovium. In late stage, it causes the fibrosis. Now to mnemonic, to learn all the features of rheumatoid arthritis: A, B, C, D, E, F, G, H, S, T, U, V, W, X, Y, Z. A is for autoimmune disease. B is for Boychner deformity. C is for anti-CCP, most specific antibody. D is for DIP joint spared. E is for erosive arthritis. F is for fibrous ankylosis. G is for Zenu valgum. H is for Helix valgus. S is for Soynek deformity. T is for triple deformity of knee. U is for ulnar deviation of finger. V is for vasculitis. W is for wind swipe deformity. X is for X-ray shows just articular erosion. Y you have to skip. Z is for Z deformity. And you have to understand, no sclerosed and osteophytes. These are seen in osteoarthritis, not in rheumatoid arthritis. Okay. Rheumatoid arthritis has association with carditis, pleuritis, and Pelty syndrome. Treatment by physiotherapy and giving the methotrexate. Next is ankylosing spondylitis. So ankylosing spondylitis is inflammatory arthritis. Axial skeleton is affected more than the appendicular skeleton. HLA-B27 is positive. Males are more common. Patient will present with uveitis, morning stiffness, cardiac manifestation, decreased chest expansion. Male is more affected than female. Okay. SI joint is most commonly involved. You have to remember these patients. I have seen many patients in my residency during the OPD. 30 to 35-year patient came with chronic back pain and a pain at SI joint. Okay. So you will see there are so many. You can see this is the. So dagger sign is ossification of interspinous ligament, and railroad track sign is interapophyseal ligament of ossification, and the combination of both is trolley track sign. Okay. You can see this, they are written single radiodense line on frontal radiograph relating to ossification of supraspinous and intraspinous ligament. So this disease is commonly seen in male, a young male, which has HLA27 positive, present with SI joint pain and back pain. And you will find features like uveitis, okay, cardiac manifestation. These all are seen in ankylosing spondylitis. Pathology by encephalopathy, calcification or bone formation, okay. Inflammation causes the erosion, then regeneration, then calcification. Restriction of movement. There is a test to detect, Pavet test, Gensler test. These all are the tests to detect the ankylosing spondylitis. Now, it is also, Fabry test is also known as Patrick test. Now to remember all the clinical features of ankylosing spondylitis. बीबी ने समोसा दिया था, इसका क्या मतलब है? B is for bridging syndesmophyte, B is for bamboo spine, enthesitis, sacroiliitis, morning stiffness, squaring of vertebra, anterior uveitis, dagger sign, trolley track sign. These all are seen in ankylosing spondylitis. In earlier stages, we used to recommend patient for physiotherapy. In late stages, we will manage patient according to where it is affected. If the hip affected osteoarthritis, then we will go for THR, total hip replacement, okay. Now, Siny corner sign, these all are seen in ankylosing spondylitis. Next is psoriatic arthritis. So Casper criteria is used. Arthritis, multi-lens, sausage disease, penicillin cup deformity, okay. These all are the features of psoriatic arthritis. Pseudo gout, these are the CPPD, crystal deposit in knee joint, okay.